chronic fatigue that never lifts, joint pain that no scan can explain, a fog in your head that makes you forget why you walked into a room, and doctor after doctor telling you every single test came back normal. If any of that sounds familiar, then what I'm about to walk you through today might finally connect the dots you've been missing for months, maybe even years. There's a growing understanding in medicine that hidden, low-level infections sitting quietly inside the body could be silently fueling a huge range of chronic health conditions that never get properly traced back to their real cause. Stay with me for the next few minutes because I'm going to explain exactly what these hidden infections are, why routine testing so often fails to catch them, and what you can actually do to start addressing this the right way. Welcome to VitaRoot Health, the channel that goes beneath the surface of chronic illness to help you understand what might really be happening inside your body. Every episode here is built to give you real, grounded information you can bring straight into your next doctor's appointment so you stop feeling dismissed and start feeling equipped. If you've ever left a doctor's office more confused than when you walked in, this channel exists for exactly that moment. So make sure you're subscribed before we dive in. Let's start with the basics. When we talk about undiagnosed infections quietly driving chronic disease, we are not talking about the obvious kind of infection, the ones with a high fever, a visible wound, or symptoms severe enough to send you straight to urgent care. We're talking about a much quieter category of infection, one that can linger in the body at low levels for extended periods, without ever announcing itself clearly. Common examples include viruses like Epstein-Barr virus, which the vast majority of adults were exposed to at some point in their life and assumed had simply passed through their system, when in reality, it can remain dormant in the body and occasionally reactivate under the right conditions. Certain bacterial infections, including some tick-borne illnesses, can also persist long after the original bite or exposure, particularly if the initial infection was mild enough to go unnoticed and untreated. And there are gut-related possibilities too, like small intestinal bacterial overgrowth, or the lingering aftermath of a stomach infection that permanently altered the delicate balance of bacteria living in your digestive system. Here's why this actually matters so much for your overall health. Your immune system doesn't simply shrug off a lingering low-grade infection and move on. It stays engaged, continuously working in the background to try to keep that infection contained. And when that immune activation runs for months or years instead of days, it produces a state of chronic low-grade inflammation. This isn't the kind of inflammation you can see or feel directly, like swelling around a sprained ankle. This is a quiet, systemic kind of inflammation that can spread its effects across nearly every organ system in your body, which is exactly why the resulting symptoms so often look completely unrelated to any kind of infection at all. Let's talk about fatigue first, because it's one of the most commonly reported symptoms in people dealing with this kind of hidden infection. Maintaining an ongoing immune response is metabolically expensive. Your body has to allocate a significant amount of energy toward keeping that background immune activity running, and that energy has to be pulled from somewhere, often at the expense of the systems responsible for keeping you feeling alert and energized throughout your day. This is part of why so many people describe a fatigue that feels fundamentally different from ordinary tiredness, a heavy, bone-deep exhaustion that a full night of sleep simply doesn't resolve. Then there's brain fog, another symptom that shows up constantly in this conversation. Research has increasingly pointed to a connection between chronic inflammation and disrupted communication between brain cells. And there's also growing interest in how inflammatory signals may affect the blood-brain barrier, the protective layer that normally shields your brain from harmful substances circulating in the bloodstream. When that barrier becomes more permeable due to sustained inflammation, it can contribute to the kind of mental fuzziness, memory lapses, and difficulty concentrating that so many people struggle to put into words when describing their symptoms to a doctor. Joint and muscle pain is another major piece of this puzzle. Some viruses and bacteria can trigger an immune response that ends up mistakenly targeting the body's own tissue, a process sometimes referred to as molecular mimicry, where certain structures in the joints or connective tissue happen to resemble structures on the pathogen itself, causing the immune system to attack both. This is a big part of why people who eventually receive a proper diagnosis for a lingering infection often spent years being told their aches and pains were simply due to aging, stress, or overuse, when there was actually a hidden immunological process happening the whole time. Digestive symptoms deserve their own spotlight here as well. A massive portion of your immune system actually resides in your gut, alongside trillions of bacteria that influence everything from nutrient absorption to mood regulation and beyond. When a chronic infection disrupts that delicate internal ecosystem, whether it originated from a bacterial, viral, or even parasitic source, it can trigger bloating, irregular bowel patterns, sudden food sensitivities that seem to appear out of nowhere, and nutrient deficiencies that then create their own separate cascade of symptoms throughout the rest of the body. So why does standard testing miss so much of this? A big part of the answer comes down to what conventional blood panels are actually designed to detect. Most routine testing is built to identify acute, active infections, situations where pathogen levels are elevated enough and the immune response is dramatic enough to show up clearly. Chronic, low-grade infections frequently exist below the threshold that standard testing is calibrated to catch, meaning someone can have an infection actively contributing to inflammation and symptoms while still walking away with a completely normal-looking lab report, simply because the test wasn't built to look for that particular pattern in the first place. There's also a structural reason behind this gap. Many doctors are working within healthcare systems that prioritize speed and volume, and unless a patient specifically requests more specialized testing, there often isn't the time or built-in incentive to explore less common possibilities. This is exactly why self-advocacy becomes such an important part of getting to the bottom of chronic, unexplained symptoms. If your basic panels have come back clean, but you still feel far from yourself, it's worth having a direct conversation with your doctor about more targeted testing options, including specific antibody panels for viruses like Epstein-Barr, testing for tick-borne illnesses if you have any history of relevant exposure, or a referral to a specialist who focuses specifically on complex chronic conditions. Now let's move into what you can actually do about this, because identifying the problem is only useful if it leads somewhere actionable. The single most important step is finding a healthcare provider who takes your symptoms seriously and is genuinely willing to dig deeper than the standard checklist. Depending on your specific symptom pattern, this might mean seeking out a functional medicine practitioner, an infectious disease specialist, or a rheumatologist, since each of these specialists brings different diagnostic tools and a different clinical lens to the table. Alongside proper testing and diagnosis, there are foundational lifestyle changes that support your immune system's ability to manage chronic inflammatory processes, regardless of the exact underlying cause. Consistent, high-quality sleep is one of the most powerful tools available to you, because your immune system performs an enormous amount of its regulatory and repair work while you're asleep. Chronic sleep deprivation directly impairs immune function, making it significantly harder for your body to keep any lingering infection properly contained. Managing chronic stress is just as critical. Prolonged stress keeps cortisol levels elevated, and while cortisol plays an important role in short-term immune regulation, chronically high levels can end up suppressing certain aspects of immune function while simultaneously fueling inflammatory activity elsewhere in the body. This helps explain why so many people notice their symptoms intensifying dramatically during the most stressful periods of their lives. Nutrition plays a foundational role here too. A diet built around whole foods, a wide variety of colorful vegetables, adequate protein, and healthy fats gives your body the raw materials it needs to support proper immune function and keep inflammation in check. Cutting back on heavily processed foods and excess added sugar can also make a real difference, since research has repeatedly linked these to increased inflammatory activity throughout the body. This isn't about adopting some extreme or overly restrictive diet. It's simply about giving your body steady, quality support while it works through a chronic underlying issue. Gut health deserves special attention in this conversation as well, given how deeply intertwined the digestive system and immune system really are. Supporting a diverse, healthy gut microbiome through a wide range of fiber-rich foods, combined with working alongside a healthcare provider to correct any specific imbalances that show up on testing, can meaningfully reduce the overall inflammatory load your body is carrying day to day. Before we wrap up, I want to be very clear about something important. This video is designed to give you information and help you ask sharper, more informed questions, not to diagnose you or replace proper medical care. If you're dealing with persistent, unexplained symptoms, the right path forward is always working closely with a qualified doctor who can order appropriate testing and guide you through a proper diagnostic process based on your unique history. Hidden chronic infections are a real and increasingly recognized part of the broader chronic illness conversation, but they aren't the answer for everyone. And trying to self-diagnose without professional guidance can sometimes send you down the wrong path or delay discovering what's truly going on in your specific case. Here's the bigger takeaway I want you to walk away with today. If your labs keep coming back normal but you still don't feel like yourself, you are allowed to keep asking questions. You are allowed to pursue a second opinion. You are allowed to push for more specific testing when your instincts are telling you something is off. Chronic unexplained symptoms deserve real investigation, and understanding that hidden infections could be part of the picture gives you one more powerful tool to bring into that conversation with your doctor. That brings us to the end of today's deep dive. If this video helped connect some dots for you, or finally gave you the words to describe what you've been feeling, please hit that like button. It genuinely helps this information reach more people who might be quietly struggling with the exact same thing. Drop a comment below and let me know what topic you'd like us to cover next, because your input truly shapes what we bring you on this channel. And if you haven't already, make sure you're subscribed to VitaRoot Health, because we'll keep breaking down the science behind chronic illness so you can walk into every future doctor's appointment feeling informed, confident, and ready to advocate for yourself. Thank you so much for watching. Take care of your health, and I'll see you in the next one.